Hello, my name is Robin Garcia, and I am in interviewing 325. Today, we're going to review patient satisfaction, the positive aspects and the negative aspects. We are currently in the home of Jane Wengert. She is a neonatal intensive care nurse. She's been in that role for over 25 years. She has seen many trends throughout our profession over the years. Our main goal is to see if patient satisfaction is a positive or is it a negative in this 2016. I specifically am interested in hearing from nurses that are at the bedside. Do they think patient satisfaction is a good quality? Is it something we need to continue, or is it just a trend and over the years will fade away? So, Jane, tell me some of the positive aspects that you feel as far as in regards to patient satisfaction from a patient perspective.
So like you said, Robin, I've been doing this a long time. When I first started, we actually had visiting hours. The nursery was open from like 8 o'clock till 8 o'clock at night. Parents were not allowed to come during certain time, and parents were not as involved. With the increase in the importance of patient satisfaction, I believe there's a transparency that is occurring, and parents are being more involved in the care of their child. It is a difficult thing also, but as far as for us, the professionals, but however, it is something that I believe is going to be staying here. I mean, everywhere you go, there's a level of excellence that is expected from you, whether it's for the Walgreens to pick up your prescription or to Potbelly's to get your sandwich. I mean, there's a level of excellence in our community, and I believe that is in healthcare also. And it's actually been a good thing. Parents are more involved. Everyone knows what is going on. There's no mystery to your care. As long as you come and you show up, you're going to know what's happening.
Great. So, from a nurse's perspective, what do you think are the positives?
As far as like the patient satisfaction scores, I think some of the positive aspects, like we, the transparency of all of it has improved our communication skills as far as with the physician and the families. We involve them from the moment that they come in. If no one wants to be in the NICU and it is an emergency situation, and usually the baby does need stuff done, but usually there's someone assigned to go by the parent and to explain what is going on. It is more difficult, but I think it is also something that's very necessary because everyone wants to be involved in their health care.
So, do you think because patients want to be more involved and the push for patient satisfaction that parents actually taking more care at some point in time, maybe not during admission perhaps, but maybe throughout their care, lightens your load where maybe back in 8-10 years ago you'd be doing a feeding and now
Parents do it, and that is like our purpose is to teach them to take care of their baby, not for us to do it. And I think that's been the biggest change in neonatal nursing, is before we would provide all these tasks, and now it is the expectation that the parents should provide all this.
Okay. So, as far as some negative aspects of patient satisfaction, I mean, you talk to nurses, and everybody has an opinion, and I'm sure parents have the same. What kind of negative aspects do you think patient satisfaction, due to the push, you've had to encounter?
There is always this need to be excellent every day, every moment, and that can sometimes be an unachievable goal. As stuff in healthcare, no one expects to be in the NICU. It is a stressful time for everybody, and achieving that can be very difficult. One of the things is like mothers want to stay over, and we sometimes provide a room for them. And they'll be at the bedside, not eating, not sleeping, not taking their medications. And that can be difficult on them. And then they become more emotional because they're not taken care of. So it can be very challenging.
So when the parents sleep over, you give them a room. How do they pay for that? How does that work?
We give them a room. We provide them with a room. We do not provide meals for them or medications, but we do provide them a room. And in my experience, there have been parents who've maybe stayed a night here or there. There was one family that stayed for 12 weeks, and the hospital acquired that cost. So it can be very challenging.
I can just imagine. I can imagine personally not sleeping. I'm just going to a hotel. It's hard to sleep in somebody else's bed, so I can't imagine having to sleep in the hospital either. So overall, in your opinion, your professional experience, nurse for 25 plus years, you've seen, a variety of changes and trends and stuff. You think patient satisfaction is a positive, or do you think overall it's a negative?
I think overall we need to make it a positive thing. I mean, it's not going away. It's something that is going to be expected. Patients can go online, see what the trends are, see what our clinical outcomes are. So unfortunately, I think it is here to stay.
Great. Well, thank you so much, Jane, for being a part of this interview. And next week, I will be discussing employment interviews. So we will see you soon. Thank you.